If your heart stopped or if you stopped breathing, would you want CPR and be brought back to life? For a lot of us, our initial response may be, well, of course. Why wouldn't I want to be brought back to life? And yet many patients choose a DNR or DNI order. DNRs and DNIs are essentially legal orders that tell healthcare providers and teams what a patient does not wish to receive in the event of a life-threatening health event. DNR stands for Do Not Resuscitate. Resuscitation is the medical term for the actions or treatments that healthcare providers perform to save your life. A DNR order means that performing CPR is prohibited in the event of a cardiac event. This encompasses chest compressions, cardiac drugs, and the insertion of a breathing tube. DNI, on the other hand, stands for Do Not Intubate. A DNI order means that chest compressions and cardiac drugs may be used, but the usage of a breathing tube is forbidden. Oftentimes, a DNR order also includes a DNI order. This is because restarting someone's heart requires supporting their breathing too, but DNI orders can be separate from DNR orders. When someone starts to have difficulty breathing, the heart may continue beating for a period of time. If someone stops breathing completely, the heart cannot last that long. So why and when would someone choose to obtain a DNR or DNI? There are many reasons why people may want to have such orders. The most common reason people think of is simply due to a patient nearing the end stage of life. So if someone is really old, or if someone is really ill, they may not want to be resuscitated or intubated. It just comes down to how resuscitation would impact their quality of life. If someone is at the end stages of an illness or is truly advanced in age, as morbid as it sounds, it may be more comfortable to pass away than to be resuscitated and intubated. Other reasons why someone may want to obtain a DNR or DNI include them having terminal diseases, advanced chronic illnesses, honoring religious reasons, and more. However, the decision ultimately comes down to simply personal preference. So how are these orders established? After being familiarized with the risks and benefits of these orders, there are lots of different options one can consider executing. Number 1, physician order for life-sustaining treatment. This is a medical document that details your wishes. A healthcare provider files it, and the document can travel with you between facilities. So for example, from a nursing facility to a hospital. Number 2, an advance directive. This is a legal document that explains any wishes you have for your medical care in the event you cannot speak for yourself, like if you're in a coma. Number 3, a living will. This is a specific type of advance directive in which you clarify the medical treatments, procedures, and medications you do or don't wish to receive to keep you alive. If you can't speak for yourself, your providers can refer to healthcare instructions in your living will. Number 4, durable power of attorney for healthcare. Whether or not you have a document that explains your wishes, it can be helpful to appoint someone to make decisions for you if you are unable to. They can communicate your preferences and enact the DNI or DNR orders. One important thing to bear in mind is that DNR and DNI decisions are 100% reversible, and they can be withdrawn at any time.